So once again, I am Marissette Hassan, Program Coordinator for the South Carolina Coalition for the Care for the Seriously Ill. I want to welcome you today to our virtual symposium. We have been doing this annually now since COVID, so this will be our fourth annual virtual symposium. And so we welcome you to what we're going to be doing this week. We have an amazing lineup of topics every day this week from 8 a.m. to about 9:30. We wanted to allow for enough time. Some days might take a little less than an hour and a half. Some days might take the entire 90 minutes. And so we want to make sure that you join us each and every day. CSI, which the coalitionally is affectionately called, has been in existence for those of you who are new since 2010. We were started and founded by the South Carolina Medical Association as a part of an ad hoc work group to the South Carolina Medical Association Bioethics Committee. And since that time, we have done some very intentional and strategic work in the state. One of our very huge accomplishments is that of the South Carolina Physician's Order for Scope of Treatment, which we call POST. So that now is available statewide to individuals throughout South Carolina, where physicians, APRNs, and physician assistants can execute post forms for patients who are seriously ill with a life expectancy of 1 to 2 years. There are many other things that we've been engaged in, but since we're coming right off of the South Carolina Healthcare Decisions Month, I've got post top of mind right now. We want to welcome Alexis Donahue to the Zoom platform today, and Alexis and I were getting acquainted just a few moments ago. First of all, I want to thank her for her service as a military wife. She told me that she did her duty as well as a military wife, but she's also been a social worker for more than 30 years. She absolutely loves working with patients and their families, and came on board at the Ralph A. Johnson VA Medical Center just a few short years ago. In my mind, everything now is pre-COVID and post-COVID because that 3 year period was so huge. And so Alexis absolutely served the last 6 years pre-COVID and was very instrumental during that time, still seeing patients at a time that was very critical for those not only in South Carolina, but also across our nation. Today, Alexis is going to share with us about veterans and the eligibility for hospice benefits. As you know, hospice patients typically come on board 6 months with a prognosis of 6 months or less. And we do see patients in the general population, but our veterans also are available or have access to hospice services, and they're able to, because of their veteran benefits, to be able to have some additional services as well. So I'm looking forward to hearing what Alexis has to share with us today. I want to encourage you to put your questions in the chat. We'll be monitoring the chat, and we will have some time for Q&A at the end of Alexis's session. Now, she's going to ask you guys to give her some grace today because she is going to be working these slides by herself today. So we all have been there. We know sometimes, I know for me, my keys always stick when I have to do a slide presentation. When I practice, it's always fine. And then when I have to do it, the keys stick. And there is this really uncomfortable pause that happens. So Alexis, you're in good company. And I'm going to turn it over to you now. Thank you again.
Thank you for having me. Can you hear me okay? Perfect. And I will also be very upfront come the end when there are questions. If I do not happen to know the answer, I will make sure I find the right person to get me that answer for you. Um, what is the phrase? Jack of all trades, but master of none.
Yep, that is the correct phrase, Alexis. I
Okay,
think as moms, we wear lots of hats, right? So,
for sure.
we know a little bit about everything.
That is correct. Okay. So I'm going to start with the learning objectives today. Understand veterans hospice benefits, utilize VA benefits in service to your veterans on hospice, navigate the VA enrollment and vesting maze, and quickly reach a hospice palliative care point of contact. We actually, there's a not so new initiative, but it's one we started a few years ago called Community Connections. The VA definition of hospice, and as Marisette had spoken to you earlier, the veteran has a life expectancy deemed by a VA physician to be 6 months or less if the disease runs its normal course. Okay, sometimes a patient can surpass a 6 month prognosis, and sometimes it's less. The focus of care is on comfort and quality of life, though this does not exclude disease modifying interventions. So, kind of what I can speak to that is sometimes, and I'll get to this later in the presentation, our veterans are able to receive concurrently home hospice in addition to maybe a palliative chemo or radiation. The veteran or family healthcare power of attorney makes an informed decision to receive hospice care, and hospice services are delivered by an interdisciplinary team that has expertise in this area. One of the things I always like to do is just to remind everybody that there is an absolute difference between hospice and palliative care. So, the definition of palliative care is compassionate comfort care that provides relief from the symptoms and physical and mental stress of a serious or life limiting illness. Palliative care can be pursued at diagnosis, during a curative treatment and follow up, as well as at the end of life. In talking about hospice care, it is also compassionate comfort care, but it is not curative care for people that are facing a terminal illness with a prognosis of 6 months or less, based on the physician's estimate if the disease runs its course as expected. And then hospice eligibility requires that two physicians certify that the patient has less than 6 months to live. Again, if the disease follows its usual course. So in hearing that definite distinction between hospice and palliative, and all too often, folks use the word synonymously, and they are not. Okay. So here starts the presentation about the veterans' hospice benefits. So hospice and palliative care is covered for all enrolled veterans, and it is included in every enrolled veterans basic medical benefits package. The VA offers to provide needed hospice and palliative care services for all enrolled veterans, whether they are in the inpatient setting or whether they are at home. And the VA ensures that all enrolled veterans that are in need of and desiring hospice care have access to these services. Our team provides palliative care and hospice care education to veterans, their families, as well as other healthcare providers. So, veterans hospice benefits. When a veteran is placed by the VA in a contract community nursing home for the purpose of hospice care, the cost of that care including the nursing home portion of that care, is covered by the VA. It's covered by that hospice benefit for up to 6 months. After that, the vet will need a secondary payer source or a discharge plan. So, and I'm going to kind of, again, as I move into this presentation, talk about the enrollment and the vesting and all of that. But again, keep in mind that the contracted community nursing home placements, the veteran must be part of our medical care system, which involves enrolling and things like that, going through that vesting process. Let's see. Routine home hospice care is provided in the veteran's place of residence, which may be a home, a nursing home, an assisted living facility, or other community-based residential settings. And again, that's when an interdisciplinary team from an agency in the community helps the vet and family in that setting, in the setting that that patient calls home. Inpatient hospice care is referred to as a patient being in a VA facility, which is always the preferred site when there's an inpatient setting. We still have Liberty Hall here. It is just not actively open at the present time. There was some construction within the hospital. So right now we do not have an active hospice inpatient, but hopefully in the future that will reopen for us. So when a veteran is placed by the VA, oh, sorry. So when the veteran is either placed by the VA in a contract nursing home, or when they are under the hospice benefit.
Morning. Morning. How are you? Pardon.
Sorry.
Good morning. We're going to ask you to mute your lines, if you will. And also, if you guys would introduce yourselves via the chat with your name and your organization. Thank you.
Okay. So these are the additional veteran hospice benefits. So veterans may receive palliative radiation, some surgeries, some palliative chemotherapy, or even transfusions that are paid for by the VA concurrently while under hospice services. It is the veteran's choice whether to use Medicare or other insurances for funding hospice or having the VA pay for those hospice services. So what I was saying prior to coming on was there are a couple of home health coordinators that I work very collaboratively with, that when we do find a patient that is going to be doing home hospice and they still want to receive the palliative chemo or radiation, that I get to hand those over and they do the billing portion and ensure that the VA is picking up those palliative services while the Medicare will be picking up the hospice services. So again, the VA will pay for up to 6 months in a skilled nursing facility that we contract with when they are under hospice. It's called a long-term care end-of-life contract. And then if the veteran meets not only the criteria for hospice, but they must also meet the criteria for nursing home level of care. And so how that happens for a veteran to get approved for the contracted nursing home bed, a member of our palliative care team needs to review the clinical information on all the veterans that are seeking this placement. If a veteran is not at the hospital, what happens is the outpatient social worker compiles the information, whether it's from a home hospice agency or from their primary care provider, and then they send that information to our palliative team to review for appropriateness. Again, meet level of care need and meet hospice eligibility need. As I said earlier, we had a wonderful, we do have, my office is on Liberty Hall, where we had an active inpatient, but right now we are not taking referrals due to some construction that's within the hospital. Okay. Here's some meat and potatoes, the eligibility, enrollment, and vesting. So in order to be eligible for VA medical services, the veteran must have been discharged or released under conditions other than dishonorable. The first thing that a veteran should do to see if they are eligible is what's called the application, the VA Form 1010EZ. Okay. This can be done in person at a VA facility, whether that be here at the Ralph H. Johnson or any of the CBOCs, like there's one in North Charleston and Goose Creek. Or they can call that number and speak to a representative, and they can walk through that with them. And again, look at the on the slide. It will also give you how to do this form online. That is step one. And it seems like a lot, but I'm actually going to make your lives easier when I get to a few slides up on all of this. Okay. So here we go. You may be eligible to enroll in the VA healthcare if you served in the active military, naval, or air service, including being called up from the National Guard or Reserve by a federal court, and you didn't receive a dishonorable discharge, and you meet at least one of the service requirements for enrollment. You must meet at least one of these service requirements, and here they are. You served at least 24 months in a row without a break. That's what's called continuous. Or for your full active duty period, or you were discharged for a service-connected disability, or you were discharged for a hardship, or what's called an early out. Or you served before September 7th, 1980. Okay. I will get to Miss Jennifer Allison Ward in a minute. I just wanted to pull that up because she is a very important person for you to write down and get her number, as well as the numbers underneath where it says enrollment and vesting. Time spent on active duty status for training purposes only does not count toward the service requirements. So what is needed to apply? So whether we go the route starting with the 1010, what they're going to be asking for: Social Security numbers for you, your spouse, if you're married, and any dependents that you may have. They're going to ask if you have any insurance card information for all health insurance companies that cover you. This includes any coverage that you get through a spouse or significant other. And this also includes Medicare, any private insurance or insurance from your employer. You can also provide your military service history information, any details about exposure to toxins and hazards, because this is Though that information often gets looked at to see if a veteran can get what's called a service connection disability. And that includes a monetary compensation each month. You can also bring, and they may also request a copy of your DD 214. The reason I'm telling everybody all this information is if you work with veterans, it's wonderful to have this information ready for them if they are interested in accessing some medical benefits from the VA. These are the things they're going to need to provide. So a copy of DD 214 or other separation documents. Income information for that veteran, for their spouse or any dependents that they may have. And again, that includes income from a job or from any other sources, and deductible expenses. So that's expenses that they can subtract from their income for them, for their spouse. Those expenses will lower the amount of money that we look at to consider income. Okay. So here we have the Veteran Outreach Program Specialist. Her name is Jennifer Allison Ord. The VA started this program. It's been maybe a couple of years now, 2 to 3 years. It definitely was not here when I started at the VA 6 years ago. She is amazing. And so here is what Miss Allison Ord is able to do. I just went through some slides about looking at eligibility and then how to go forward with looking to get somebody enrolled, which includes that vesting appointment. Jennifer is able to start from the beginning of that process and walk that veteran and family through right up until they help them get that vesting appointment. So with all the steps I just gave you, you can give that and know about that to do that independently, do the 1010EZ, etc. But calling Jennifer Allison Ord or emailing her saying, hey, I have a veteran. I don't think they're in your system, but we know that they can, if they're eligible for VA medical benefits, they could sure use some of your services, whether it be homemaker or at some point in getting placement for hospice in one of our contract nursing homes. Jennifer can be that phone call that you make. And then what she will do is work with that veteran and family, get all the documents they need, help them fill out that form, go through the process. And again, if they are eligible, she will help them make that vesting appointment. So it's almost, I call it one-stop shopping. She certainly is a miracle maker to take, because it can be overwhelming. The VA system can be overwhelming. And again, so she's a great person to know and have as a contact for those veterans that say, I don't even know if I'm eligible. Call her and she can start and walk them through step by step. I mean, she drives up to Myrtle Beach to meet with these veterans. So she can be very helpful. Okay. So some benefits, some veteran benefits, and I just kind of spoke to this. The homemaker home health aid. So homemaker services can provide limited ADL assistance, right? Activities of daily living in the home, in addition to the hospice aides, which is wonderful. They can do that at the same time. The thing that can't happen, right, if somebody's getting home hospice and then they apply for homemaker and they get it, they cannot come to the home on the same day. So being able to offer the homemaker in addition to hospice services really helps the family be as successful as possible if the goal is to keep a veteran at home for the end of their life. Homemaker is something that we don't add into if a veteran is going into a contract nursing home, but it is very, very helpful to add those additional homemaker services to home hospice, again, to help those families as much as possible. So the VA can also provide respite for caregiver We can also provide respite for caregiver relief, and it's a 30 days maximum per year. And that is in one of our contract nursing homes, or it can be in the home, which is assessed on a case by case basis. It's not typical. Typical, the respite is in one of our contract nursing homes, but on a case by case basis, we look at if somebody has a need for that respite to be done in the home. It is not 24 hours if that is approved, though. It's within a 6 to 8 hour window, if it is done in the home. Home improvements and structural alterations. So the VA provides up to $6,800 in lifetime benefits for service connected vets, and up to $2,000 for non-service connected vets for home improvements and or structural changes that are related to disability access to the home or laboratory facility. And this is handled by our prosthetic department at the VA Ralph H. Johnson Medical Center. So an example of that would be if somebody were to have a tub shower in their home, and they would be safer, it would be more beneficial to have them to have that made into a walk-in shower. Again, we like to get this on the front end and let them have this information, because what the VA won't do is, if somebody went ahead and did that on their own and paid for a contractor to come in, the VA won't go back in and reimburse them for that. They have to be on the front end and get the request, approve the request, and then go in and they do the contract for the workers to go in. And that's just an example, change a tub shower into a walk-in shower. Okay. Additional benefits for our hospice patients. We have a caregiver support program. That includes education, outreach, peer support mentoring, skill training, coaching, telephone support, and online programs. And up on the screen is the support line. Comprehensive services are the enhanced clinical support, monthly stipend, counseling, and beneficiary travel. Okay, so what this is saying is, if one of our hospice veterans is 70% service connected or higher, their caregiver, their wife, their adult child, their whomever, may be eligible for monthly stipend, monetary stipend, to help take care of that veteran in their home. Okay. Again, it's that 70% service connection or higher. Keep in mind, these are so important because this is extra money for the veteran and these families. Okay. Some people have to leave their jobs to take care of somebody. So it behooves any veteran to become part of our healthcare system. They do not have to receive all of their healthcare from us, but if they become part of our system, there's so many things that they can be offered as a way to help them as they start to age and when they are eligible for hospice services. So these are some of the things that fall under that caregiver support program. So the eligibility, the ADL need for 6+ months, functional impairment that impacts personal safety. So this program expanded from the post 9/11 veterans to pre-May 7th, 1975. And then the program expansion to veterans of all eras expected happening October 1st, 2022. Here is a link if you wanted to get more information on the program. For those caregivers to be able to get monetary compensation or even just the support from other people that are working with veterans in the home. I am just going to kind of go through a few slides, and I believe Marisette said she's going to send out the PowerPoint for all of you, so you will get this. But these are just some point of contacts for various VA medical centers for folks that work in the hospice palliative teams. Here we go. Here we are. So I have gone to many hospice agencies since the start of what we called community connections. And basically, what I've done, if you are hospice or if you are an agency that would like me to come speak, I'd be happy to do so to tell you a little bit about the program. But it's actually I'm speaking of it as part of this presentation. So what it entails is. If you have if you have a veteran on your service or who you're working with and you have a VA related question, I'm the point person for the Ralph H. Johnson VA Medical Center. So you call me. Again, I may not have that answer for you, but I will find the right person for you to connect up with. Again, we know it can be daunting to have some questions about veterans and benefits and eligibility and things like that. And we wanted our community and organizations to be able to call one person and just say, here's my situation. Are you the person to talk to? And if not, who can you direct me to? And the follow-up to all of that is, if you were to call me and if I was to direct you to somebody that should be able to answer that, and one, you haven't heard back from them or they haven't been able to assist you, I am to be called back to try to get you a different person to contact. I don't want you, we don't want anybody in the community left hanging without the answer to the question. It may not be the answer you'd like, but I want to make sure that you get your questions answered. So I'm the contact person for Ralph HJ. And then this is my team that I work with every day, and I feel so blessed. So there is Chief Scott Lake, Dr. Alana Stoll, Dr. Rich Thompson, and nurse practitioners Jennifer Meyer and Rebecca Orr. We are an active team. They do clinics. They see patients that come in the hospital. We are very, very team focused. Work as an interdisciplinary team on a daily basis. But again, please keep my contact information if you do come across any VA related questions. Start with me, and then I will get you to the right person. So the community connections, well, let me go through some of these screens. Here we go. So this is the Jennings Bryan Dorn department up there in Columbia. That is the contact person. And it's, again, these slides will come to you. I just wanted you to know that if you do have veterans, even kind of across the state, you've got some people to look for help. So this is the contact for Augusta. And we've got Asheville, and we've got Durham, and Fayetteville, Salisbury, what else? The James H. Quinlan in Tennessee. Okay. So that community connections that I talked about, again, if you'd like me to kind of come privately to talk to your agency or an organization, I'd be happy to, so they could put a face with a name. But this was part of a congressional mandate to improve the care of the veterans that are on hospice. The initiative seeks to fill gaps and educate and offer telemental health services, caregiver respite support and education on whether it be VA burial, survivorship benefits that are typically not available from community hospices. So building community connections for veterans on home hospice initiative, the importance of hospice agencies encouraging veterans on home hospice to enroll in the VA. Okay, this is so important when you get a veteran on your service, or even if you're not a any agency or an organization that works with veterans. If you can remember to ask that question, ask them, are you a veteran? Are you enrolled in their health care? And then from there, right, encourage them. And then you can go straight to reaching out to our veteran outreach program specialist, Jennifer Allison Ord, who I spoke about earlier. Or email, call me, and I can actually see if they're in our system already. Because sometimes they don't know, they don't remember, they're not sure. So the building community connections for the veterans, oftentimes if they are under hospice, they're not part of our system, we can look to try to expedite that enrollment and get that initial vesting appointment quicker, because of the hospice need, right? So again, if we have somebody that's on home hospice and we find out that the family, it's just getting to be too much and placement would be helpful. Well, if they're not part of our system, there's a process now. They still have to go through the vesting appointment. So by letting us know that, we can see if we can expedite it at one of our seats, whether it be at the Ralph H. Johnson, whether it be at one of our CBOCs on Rivers Avenue, or in Goose Creek, or that kind of thing. And knowing veterans are on hospice and not part of our system and need that appointment, we can do that appointment virtually. It could be done via telehealth, and all that information is great to know on the front end if we get that call that that veteran is going to need a virtual appointment. So I wanted to put this up here just kind of for a visual for everyone. So the VA structure has really these three parts: the Veteran Health Administration, the Veteran Benefits Administration, and the National Cemetery um, Administration. What they have in common, they all have the need. If a veteran is going to try to get access to any of these three, they all have the need for the DD 214, which are the discharge papers for that veteran. They're all going to ask for that discharge paperwork. So the veteran benefits, we can see the health administration, right? That falls under us. That's the medical care. Any community living centers. So we used to have that, which was a nursing home. But we no longer have that here, but I know that Dorn, they do. But that's all falls under the need for them to be enrolled in our medical care, the contract nursing homes, the home health, hospice and palliative care, and that caregiver support program. Okay. The Veteran Benefits Administration, that middle section. So the veterans do not need to be enrolled in VA healthcare to receive those benefits. Okay. And we see under that, we've got the survivor benefits. So to qualify for some of that income after a death, the death must have resulted from a service connection condition or related to one. So the importance of knowing a veteran service connection disability and documenting on the death certificate as a cause of death or an associated or contributing condition, if applicable. That is what ties the caregiver, the wife, the spouse, whomever, to being able to receive something financial after a veteran dies. There is also education and training benefits. Again, this falls under this middle section, Veteran Benefits Administration. So education and training benefits, there's something called the Yellow Ribbon GI Bill for qualifying dependents, and housing grants or assistance for those who qualify. And those are just a few. And then we go on to the third slide, which is the National Cemetery Administration. And I'm going to start by saying, again, this will be in the slides you get, but here at the VA, we've got a whole section that is called Decedent Affairs. And the folks in Decedent Affairs are the subject matter experts on all death burial benefits. And you will get that contact information when the slides are sent to you. So under National Cemetery Administration, we've got the headstone and marker that can go to a veteran at the gravesite. Again, do not need to be enrolled in VA healthcare to receive that. So military funeral honors, that means the military men and women that come to the gravesite and they're dressed in uniform and they present the flag, those kinds of things. Presidential memorial certificates, right? Signed by our president, thanking them for their sacrifice. A burial flag, and potentially a burial allowance. If a veteran were to get monies for a burial, that would be after the family has already paid for it. They do not get money on the front end. So that's something that's important to talk to if a veteran is asking about the funeral or burial benefits, if they are eligible, that it would come after it's already been paid for. So the maximum for service-related death can be up to $2,000 toward that, and non-service-related death up to $300. So that's just kind of gives you an idea. I just went through that. Okay, this will be great contact information and websites for you to go to. Are, and again, do not need to be enrolled in the VA healthcare to receive those death burial benefits, but these are where you can find out about how to get a presidential memorial certificate, a burial flag, or a burial allowance. Just for informational purposes too, most funeral homes and crematoriums should know how to access getting a veteran military honors, a group of people to go to the gravesite. Most of them should know how to access a flag, but it's good to have this information. You can actually bring it to the funeral director, and they can help you. They can help that veteran's family make sure that that's all in place if that's what they want at their service. So veterans have unique hospice benefits. Okay, so to summarize, we've got the long-term care end-of-life contract that they may be eligible for if they meet the hospice criteria, if they meet that level of care need. They have the ability to receive VA funded palliative treatments concurrently with hospice. They have the ability to receive concurrent VA homemaker services in addition to what the hospice aid provides from the agency. They are eligible for respite care, which is 30 days a year. They potentially are eligible for the caregiver support program. They have to kind of apply to the program, and if they meet that eligibility. And while currently on hold, the inpatient VA hospice care. the VBA and NCA benefits, okay? I'm sure you've all heard of what's called aid in attendance. Subject matter experts on that. The veteran service officers or one of the outpatient social workers can help you through that aid and attendance process to see whether that veteran is able, that would be some monetary compensation to help pay for caregivers in the home. Also under that, those two. Service disability compensation. Again, the veteran service officers out in the community and a veterans community doctor may have to submit the information to review, but that's really important because a service connection disability gets that veteran access to more monies each month. And then burial benefits. You can contact a veteran service officer. They would be very much aware of what that entails. But I always recommend people go straight to the office, which is Decedent Affairs here. And again, that contact phone number will go out to you on the slides. So these are just some more resources that I'm going to send. See along. Okay, so here's what I wanted. The County Veteran Affairs Office, they are like the masters in benefits questions and knowing which forms to send and how to guide a veteran and family. I listed a lot of them in different counties, but when I'm in it, oftentimes I hear somebody say, it's really hard to get a hold of somebody in Charleston County. You can call any of these offices and they're all going to have the same information to give you. So if you get a busy signal or you get an answering machine and you don't hear back for a bit, try calling a Colleton County or a Horry County or Berkeley or Beaufort or another one, because the benefit information they're going to give you is going to be the same and they can help guide you. And thank you for your attention and for all you do for our veterans. And I certainly will be open to questions, but for those of you who joined late, what I said, I'm a Jill of all trades and a master of none. And so you may ask a question I don't know the answer, but I will certainly look to find it if I can't answer it for you.
Oh, well, Alexis, I want to say, wow, man, great information. And the slides with the information, absolutely invaluable with all of the resources. Thank you so very much for that. You can hit the stop share button and then we'll see people on the screens. But I absolutely have a couple of questions.
Okay, I have to find the stop. I have to
So,
stop.
so there's a green button at the bottom of the screen,
Oh,
and
gracious
you
me.
may be able to, and if not, don't
Oh,
worry about it. You got one there, and then you can do stop share. It should be able to tell you at the
oh
bottom
my
of this
gracious.
of the Zoom panel, you can do stop share. But I'm going to ask my question. Don't worry about it.
Okay,
We can still talk.
okay.
The first question I had was related to respite. You know, in hospice, respite is something that under the Medicare hospice benefit, hospice patients are able to receive. And it's a little bit clunky, I will say, because you have to do 5 days in a facility. You change the level of care, et cetera, et cetera. For those who on the line that understand hospice, they know about that. I absolutely love that you said that the veteran can receive respite services on hospice up to 30 days a year. Now, of course, we realize that there's that 6 month prognosis, but in that instance, which one has priority? the Medicare hospice benefit, or can they concurrently do both?
Do you mean start with like the hospice agency providing 5 and then back, and then the VA can add the
Right. Are they
additional?
able to, or yes, are
Sure.
they able to toggle back and forth or?
So the answer to that is yes, but I'm going to preface that with saying that when we get a request for a veteran through the VA to use the respite, we
Mhm.
usually ask that they work with the hospice agency to start there.
Okay. Okay.
It doesn't necessarily have to be that way. So if the hospice agency says we can't do it right now, we don't have a contract, we can't, then this we will look to
Okay.
do that. But we always start with the hospice agency, because once a veteran goes um, under hospice,
Mhm.
they pick up, they are the owners of that medical care. So that's why
Absolutely.
we always want to start there. We
Mhm.
are ancillary from that point. We kind of can tack on,
Mhm.
but the hospice agency oversees that medical care. So we definitely ask them to start with their hospice social worker and go that route first.
Okay. Absolutely understand that. Just wanted to, I know that somebody out there on a hospice was jumping up and down when they heard that 30 days.
Yeah. Yeah.
So,
And I remember doing home hospice. And so the families would take advantage of that. And a lot of them would even, offer to pay a day, 2, 3 after that,
mhm.
to get a bigger bulk of days. I want to say it's 5 days that the home hospice agencies can do.
Right, right. And of course the hospice is assessing for need for that, but it does require sometimes caregivers are just so exhausted that 5 days goes by so quickly.
Right.
And so for that, there is a question in the chat, however, Alexis, regarding if a veteran cannot find the paperwork, would Jennifer be able to assist? And I think you said yes, that Jennifer is able to do that what I call the CSI search and
She
help the
can
veteran.
she knows the people to call. She is, again, she when she came on board, I actually didn't know about her for like a year before.
Oh,
There were 2 of them. When I found out about her, I was like doing backflips in the hospital. She is like, right, she is one stop. She starts at the beginning with, "Hey, I'm a veteran and I don't know if I'm eligible for care. If I am, I'd like to get some." And there she goes. She can meet them up in Myrtle Beach. She can drive wherever just to start gathering that information and checking all that out. Again, right through helping them fill out the paperwork and getting that first appointment.
very good, very good. We do have a few people on from North Carolina, so I do appreciate that you put the North Carolina
Okay.
contacts. I see some folks that are still in the industry from North Carolina that I'm familiar with some of their names. So everything should work very similarly in terms of those benefits across, the different regions that you mentioned. So
Yeah.
very good.
Yeah.
I had one other question, and then I'm going to tell others that you guys can put your questions in the chat. I cannot see your hands, but if you put your question in the chat, then we'll be able to do that. I've made a circle. Oh, I did want to just make a comment about the veterans piece, just for general information for those who may be working with the hospice and your loved one or the patient is a veteran. In the hospice industry, we have the We Honor Veterans program that is connected with the National Hospice and Palliative Care Organization. And North Carolina, we have 113 hospices that have the We Honor Veterans designation. Of course, there's the star levels,
Yeah.
level 2, 3, 4, and 5. And in South Carolina, we have 98 hospice programs that are affiliated with the We Honor Veterans program. So for those of you, the hospices with that designation, they are looking based on their level to connect a hospice veteran patient with a veteran to be either a volunteer with them, a vet to vet in a scenario. But they also have some special, unique things that they can do for the patient as well. I love seeing the layout, Alexis, of the 3 different big buckets of departments and the benefits that are there. And also, the hospices are able to get some of those things done as well if they have a veteran patient that's on their service in terms of the last rites, being able to go to the home and to do the flag in the home as the
Yes.
patient leaves the home for the last time, when they die. There are some special things. They do pinning ceremonies as well. So I did want to bring that in for some of our folks that may not be aware that our hospices are very active in the We Honor Veterans work through the NHPCO organization. So,
Yeah, that's
um,
wonderful.
any questions, any other questions that you guys may have for Alexis? I know that inpatient hospice piece is tough sometimes as well. And the other last question I'll have while I see if there's any questions in the chat, of course, with Medicare hospice, there have to be symptoms for inpatient hospice. So they don't always admit someone because they are, showing symptoms of imminence if they're not having acute distress, in those last dying hours. And so, as it relates to inpatient hospice for with through their veterans connection, if a family said we just really cannot emotionally handle the patient dying at home, would that be considered an option for them, and from an ancillary perspective, to go to have inpatient hospice in a contracted facility just to die?
So, so the answer to that is we do it by case by case. But yes, if we hear that a family is struggling to take care of somebody, we're serving the family as well as the veteran, and we want to
Mm-hmm,
make sure that if we can help them by getting them a contracted nursing home
mm-hmm,
bed, we're going to do that.
mm-hmm,
They don't necessarily need to have, right? So inpatient, you're right, inpatient hospice, if they were going to go to like one of the facilities that are out there in the community, they need to have some form of like you said, symptom management, right? There's got to be pain crisis or something that really needs to be a higher level of care need. That is not always the case with us being able to place somebody in a contract nursing home.
mm-hmm.
It could be something like it's an elderly um, spouse that we
Yes.
know is not going to be successful no matter what we put in there
Mm-hmm,
doing home hospice. So
mm-hmm,
we would be able to look to them to do a contract nursing home for sure.
mm-hmm. That,
Again, if that veteran meets that level, right, meets that
right.
nursing home level of care.
Right, right. And they're, and of course at that point they're not able to do their ADLs. They may be semi-conscious, they're not eating they're not taking in liquids, etc.
Yeah,
Sometimes that is a tough spot for hospices. There are instances where hospices may put a patient in, but they have to put them under routine level of care, but their beds are limited. And so
right.
oftentimes those beds are available for those with acute symptom management needs. So it's wonderful to hear that that could be an option if needed.
Yeah,
We like to keep people at home, but sometimes families, as you said, if there's not a lot of support at home, it could be difficult for a caregiver, even for 24 hours or 48 hours, to manage that person, in the home setting, right there, as death as they are
right.
imminent. So thank you for
Yeah.
that.
Yeah, which is so again, we want to be able to, if a vet's wishes to die at home, that's why we can do the homemaker on top of hospice that brings in the
Mm-hmm.
hospice aide to help again cushion them as much as possible to make that placement successful at home. But
Mm-hmm.
but um in a real, just to kind of back up what you just said, why it's so important to find out if your veterans are part of the medical system
Mm-hmm.
is for us to get that call from a home hospice agency or from a hospital saying they need placement, they're hospice, and I look them up and they're not in our system, here we have to, now we
Yep.
have to go through the process. So
Yeah.
if we can get to any of the, even one veteran on the front end and just get them enrolled. And again, you can tell them you don't have to get all your care at the VA, but the benefits that you are missing out on
Mm-hmm.
if you're not part of our system, it's unbelievable. Like
Mm-hmm.
it can save a family. I mean, if they're not part of our system, a family might have to pay out of pocket for nursing home care. that's upwards of
Ooh,
10,000+ a month.
yeah,
And
yeah,
if they're
yeah,
under hospice, they're not paying a dime if
that's
they're
right.
in our system.
Absolutely. Those are so many wonderful benefits, and I believe that there will be more people sort of sharing this. We have a lot of social workers on the line today, and nurses and community advocates on the line today. So, Alexis, you have really, really helped us be able to uh, get the right kind of information out there to folks. So, thank you so much for that.
It's my pleasure. Thank you for asking me. And again, I know this is a lot of information, but take my contact information. Email's a great way to reach me and just say, "Hey, I didn't understand that. Can we talk?" Or "I have a veteran. Can you tell me if he's in this if he or she's in your system?" I am absolutely open to any of your questions. And again, if I don't know it, probably won't. I will find the right person for you to talk to for sure. So
All
thank
right.
you. I really appreciate your giving me the forum to speak to y'all.
Yeah.
And Alexis, I have a quick question. This is Jenny Forth with Prisma Health. Sometimes with veterans, we hear that they have got, reasons to not want to connect back with the VA, like connected to trauma or whatever it may be. I know that's kind of a loaded question, but is there a certain kind of part of the VA, or who's the best person to handle a patient like that? Because to your point, the volume of benefits are it's hard to just pass those by when you see someone in need that could benefit. So any thoughts on kind of how to start that conversation or move them toward the VA?
That's a great question, and I think so. Part of the reason I'm doing this, and I go into agencies and organizations to speak to the team that works with folks, is because you're really our eyes and ears. All of the organizations that work with veterans are the best way we can promote them signing on. Um, Jennifer Alcinord would be a great person again because she contacts those families directly. Um,
Mhm.
any of the if a veteran would need to be willing, right, in their family to make the phone call or to get the phone call. So again, that's promotion on your part. Um, but one of the benefits officers who are subject matter experts kind of across the board um, would be a great place for them to start as well.
Mhm. Very good. Other questions before I close us out? All right. Thank you, Jenny, for that question.
Thank
There
you.
is a lot of trauma out there, and we definitely want to get the person to the right individual. I like the fact that telehealth is an option for people as well, and that creates greater access if people don't have transportation issues and cannot get in. So thank you for that. Well, it's been an amazing kickoff today, talking about our veterans, our nation's, um, honoring our nation's veterans through hospice care and the benefits that they can receive. There's so many, and as well for the caregivers. We really need some of those caregiver benefits for the general population of folks who are caring for loved ones, 24 hours a day, 7 days a week. And when I saw those benefits, that really, really, that's special that they've carved that out for caregivers as well.
Agree.
On tomorrow, everyone, we will start again at 8 o'clock, and we are going to be focused on our workforce on tomorrow. Our great friend Morgan McCall is going to share with us about compassion fatigue, how we can do prevention and self care. Last year, when we put this topic in the queue, we found out that a lot of us were not taking our PTO time that we should. And hopefully, people have made some progress in that area since last year. And I know that Morgan is going to have more great things to share with us about self care on tomorrow at 8 o'clock. So every single day, there is going to be an amazing topic. Wednesday, we're going to hear from Dr. Tracy Fasolino about some recent legislation and policy that's going on in the end of life care space. And then we're going to talk about caregivers on Thursday. Our friends and partners with the North Carolina Serious Illness Conversation is going to share with us about the Medicare codes now for doing training with family caregivers. And then on Friday, I will close this up talking about advanced care conversations with clinicians and the faith community perspective. So often we hear that can sometimes be a barrier, and we are going to talk about that and wrap up the week with that on Friday. So looking forward to seeing each and every one of you. It's not too late to share the flyer and to invite others to participate with us. Put it all over your networks, folks that you know. It's free. We do like for people to register so we can keep track of how many people we are impacting each day. So, but all they have to do is click the link and be able to get in. And we look forward to seeing you every day this week. So the guys, have an amazing Monday, and I will look forward to seeing many of you in the morning at 8 o'clock. Thank you again, Alexis. Everyone have a great day.